In this lecture about coma, I want to talk about what happens as a result of a major insult to the brain. We're going to go through coma, persistent vegetative state, brain death, and locked-in syndrome. Let's start off by talking about my framework for how I see the brain evolutionarily. The cerebrum is the thing, this is a brain, the cerebrum is the thing that's most evolutionarily new. It's what makes people people. It's your ability to work through a problem, to talk, to remember. It is important for being who you are, but it is not important for survival of the rest of the body. What is important for survival is that which is evolutionarily ancient, and that is the brainstem, where your brainstem reflexes come from. Of course, none of this would work if you didn't have a cardiovascular system to supply blood. And there are peripheral nerves that come off from the spinal column that allow us to see and feel. We're going to compare a couple of diseases, and the way I want to do this is by looking at cerebral function, brainstem reflexes, what the heart is doing, and can they feel and move. So a normal person, let's talk about normal first, they're going to have cerebral function that's intact, their brainstem reflexes are working, their heart is beating, and they can move and feel. If you compare that to a coma, some insult has occurred that has caused the person to lose consciousness. In this case, the cerebral function is depressed. It's not absent, it's not gone, it's just less than a normal person. But all that's happened is the cerebral function has gone down a little bit. They still have brainstem reflexes, their heart is beating, and if they were awake, they'd be able to move and feel. There's a lot of things that can cause coma, essentially being passed out. And when you encounter someone where you don't know what's going on, you might do a lot of things all at once. You'll hear in the ER the coma cocktail, a combination of naloxone to reverse opiate-induced coma, and thiamine and D50 for hypoglycemia. Likewise, you might just give fluids to support the blood pressure and give oxygen until you know what's going on. Of course, some comas are a little bit longer than just a simple delirium, but recognize that someone in a coma can wake back up to be normal. The way you determine someone's cerebral function is active is to get an EEG. Now, if we compare normal in coma to persistent vegetative state, we realize that there is no cerebral function. Whether metabolic or anoxic, the injury was so severe that the body sacrificed the cerebrum in order to maintain the thing that keeps it alive. So in persistent vegetative state, there is no cerebrum. The brainstem reflexes are still intact, so the person is going to breathe. Their heart is still beating, and actually they do still have motor function. They can't interact with the world in a meaningful way. They can't communicate their needs. They can't say they're feeling pain. But they do move. Some of these patients have sleep-wake cycles. They open their eyes, they may track. You put food near their mouth, they may swallow. These things are part of the brainstem, and so the patient looks like they might still be there, but really there's no activity in the cerebrum. Brain death is actual death. In brain death, there is no cerebral function, no brainstem reflexes. The heart is beating, and there's no way they're going to move because the thing that controls the nerves is gone. In this case, the entire brain, including the brain stem, has been lost. If you diagnose someone as brain dead, they're likely to be on a ventilator. You disconnect the ventilator and see what happens. When they don't breathe, they are absolutely dead, and you call the family. The only thing that makes them technically alive is their heart is beating. But they would just lay there on the ventilator, heart tacking away, unless you pull the plug. But in brain death, they're actually dead. And the way you determine if someone is brain dead is the absence of the brainstem reflexes. Of course, in the way of the heart, you're going to get an EKG, and motor, you're going to do a physical exam. Brain death is the absence of the brainstem reflexes. Brain death is determined by 2 or more physicians simultaneously. You're also going to do things like get the EEG, which will not show any function. You might get a CT scan or MRI, which will show loss of the gray-white junction. But the way you determine brain death is by checking the brainstem reflexes. And the reflexes you need to know about are the corneal reflex, the cold water calorics. I remember only cold water, and then remember that warm water is the opposite. And then doll's eyes. In the corneal reflex, take a Q-tip, touch their eyeball, nothing happens. Cold water calorics are worth talking about, so I'm going to say it out loud. The mnemonic you learned, cows, cold, opposite, warm, same, refers to the quick beating movements of nystagmus. If you do the cold water calorics to me, squirt cold water in my right ear, my eyes are going to go towards the cold water, but the rapid nystagmus away is going to be opposite. Shoot cold water, eyes move to the right, beat to the left. If you have no cerebrum, and the cerebrum is the thing that manages the rapid beating, you shoot cold water in my ear, my eyes move to the right, no quick motion away. If the brain is dead, no brainstem at all, squirt water, ears don't move. And by the way, if you do that to me now, I would vomit all over the place, a natural response of the cold water caloric test. Warm is the opposite. In doll's eyes, you move their head, their eyes stay fixed. So if you have absent corneal reflexes, cold water that don't do anything, and the doll's eyes that don't move, they are brain dead. And you know that this is true because the body would keep the brainstem alive at all costs. So if they have no brainstem reflexes, nothing is there, and once brain is dead, it's gone. I want to close with locked-in syndrome. In locked-in syndrome, you've got a Pontine stroke. The person is completely cognizant and aware of everything that's happening. They're very much alive, and their brainstem is working. Their heart is beating, so they can keep them alive, and they can feel, but they cannot move. There's a disconnect between the brain and the body in the way of movement. And the only way they can communicate is with eye blinks. That person looks like a persistent vegetative state, except they're completely cognizant of their suffering and misery. And so keep in mind that this might happen, and we need to make certain standards in order to maintain their quality of life. That is coma.